There's no doubt the thing I love most about being a GP is the people.
GP is one of the only specialties that sees a person from, as they say, the cradle all the way to the grave.
You can work with them on their individual self, their home life, their work life, their social life.
A lot of us in the rural, we actually like a family doctors to patient. So you're like an advocate to them, and they have the full trust and they always come back to you. You're like a role model to a lot of the younger generation.
So you piece together this beautiful family tree that you provide care for throughout their life.
I really enjoy that ongoing relationship and helping patients live their healthiest lives.
I think when I first came in, I sort of thought GP was just coughs and colds, but I've realised that it's so much more interesting and varied.
My own GP inspired me to become a GP. You could go to him with any problem and it was like magic, you would just be fixed. And I thought, I want to do some of that magic.
Being a GP really encourages you to keep up your skills because you have to be multifaceted.
Paediatrics, obstetrics, gynecology, emergency department, psychiatry. I loved all of them and I thought, how do I put these together? Become a GP.
We treat patients across their entire lifetime and we need to know something about everybody's systems.
The generalist function is a really important part of leadership, and in fact if you look at who most successful CEOs are around the world in companies, they're generalists.
And you're able to keep very positive because you have all those different areas of stimulation that keep you going.
It's important to emphasise what a great role general practice can have in helping prevent people get sick in the first place.
And improving primary care helps us improve health of the whole community.
So with general practice, there is huge opportunity to grow. A lot go into research, a lot go into education, a lot advance into registrar training.
We can be a general physician, can be a dermatologist, and some of us actually involved in teaching. And of course, a lot of us are business partners.
I love working in refugee health, and I love it because the medicine is amazing. You get to use your brain and think about all sorts of different presentations that you might not in ordinary kind of suburban general practice.
I worked both in a general practice and in a hospital. What drew me to it was really the ability to see the system working at both ends. And it certainly made me a better practitioner because of that.
Well, in my experience as a teacher, most people who choose a career in medicine do so because they really want to help people and make a difference. And the research evidence shows without a doubt that one of the places to make the biggest difference is working in the community in general practice.
After doing the placement program this year, the field of medicine that I want to pursue is definitely general practice.